Welcome to the "Oh no, my blood sugar is low" presentation, Learning More About and Understanding Diabetes. This is part 2 of a 3-part series on diabetes. This training is provided by American Way University. Once again, my name is Angie Danielski, and I will be your guide for this training. Please note that you should have viewed part 1 of the presentation prior to starting part 2. Here's an overview of what part 2 of the "Oh no, my blood sugar is low" Learning More About and Understanding Diabetes presentation will cover. First, we'll look at diagnosing diabetes. Then, we'll look at medications used for diabetes, including an overview of the different types of insulin and the sample medication administration record. Diagnosing diabetes is usually the easiest part of managing the disease. Blood tests, such as the hemoglobin A1C test, or HbA1c, fasting blood plasma glucose test, or oral glucose tolerance test, are all used to diagnose diabetes. The hemoglobin A1c test is a percentage that helps let doctors know what the average blood sugar control has been over the last 3 months. The normal range is less than 5.7%. The diagnosis for diabetes will come at greater than 6.5%. If the blood sugar is between 5.7 and 6.5%, someone is termed as having prediabetes or is at an increased risk for developing type 2 diabetes. We will take a closer look at prediabetes in the next slide. The fasting plasma glucose test gives the level of glucose in the blood after not eating for usually a period of 8 hours prior to the blood draw. Normal levels are less than 100, prediabetes between 100 and 126, and the diagnosis for diabetes comes at a level of greater than 126. Lastly, the oral glucose tolerance test is conducted over a period of 4 hours. A person will drink a glucose drink and then have their blood drawn after 1, 2, and 4 hours after finishing the sugary drink. Normal test results at the 4-hour mark should be less than 140. Prediabetes will be diagnosed between 140 and 200, and at a level of over 200, someone will get the diagnosis for diabetes. The term prediabetes is used to describe the condition where a person has high levels of blood sugar but not yet high enough to be diagnosed with diabetes. Those who have been identified as having prediabetes will most often develop type 2 diabetes if lifestyle changes are not made. Type 2 diabetes can be avoided for these individuals if they modify their diet by eating a diet lower in sugar and adding lifestyle changes such as increased physical activity. Medications used for diabetes are insulin, oral anti-diabetic agents, or sometimes both are used. Insulin is most often used in type 1 diabetics. However, insulin can also be used in type 2 diabetics when other medications alone do not work. Insulin can include the fast-acting types, such as Aspart or Lispro, short or intermediate-acting types, such as regular or NPH, or glargine, which is a long-acting insulin. In the next slide, we will take a closer look at the different types. Oral anti-diabetic agents are only used in type 2 diabetics. These medications are used to target various aspects to better use the body's own insulin. Some examples include glipizide, metformin or glucophage, or Actose. Metformin is a common medication used among many type 2 diabetics. Please remember that metformin may not be crushed in most cases as it is a time-released tablet. As mentioned in the previous slide, There are several types of insulin which have different onsets and durations. Onset means the amount of time that it takes for insulin to begin working, and duration means the amount of time that the insulin is working in the body. Fast-acting insulins include insulin aspart and insulin lispro. Both of these will begin working in 5 to 15 minutes. It is important that with fast-acting insulins, they not be given until right before a resident is served his or her meal. If this type of insulin is given too soon before a meal, the resident may become hypoglycemic and require further intervention. Insulin aspart and insulin lispro have a duration of 3 to 4 hours. The fast-acting insulins are often administered multiple times a day, usually before meals. Fast-acting insulins may be prescribed according to a sliding scale, which we will learn more about in the next few slides. Insulin regular is a short-acting insulin which will begin working within 30 minutes. Again, we need to ensure that the resident has his or her meal before administering the insulin to avoid hypoglycemia, or low blood sugar. Insulin regular has a duration of 5 to 8 hours. Insulin regular is also usually given more than once a day. Intermediate-acting insulin includes NPH, which helps to regulate blood sugar over several hours. This type of insulin is often given at bedtime to help control blood sugars overnight. NPH begins working 1 to 3 hours after injection and will last for 16 to 24 hours. Long-acting insulin, or insulin glargine, begins working within 1 to 2 hours, which is similar to NPH. However, it lasts for longer than 24 hours. Lastly, some residents may be prescribed ultra-long-acting insulin, such as insulin degludec or Ultralente, which starts working within 30 to 90 minutes and lasts longer than 24 hours. Here's an example of an insulin order you may see on a resident's medication administration record, or MAR. For this example, the blood sugar is checked before a dose of insulin is given and before the resident has a meal, as well as at bedtime. There will usually be an order for when a resident's blood sugar should be checked. At 8 a.m., this resident should receive 6 units of insulin aspart subcutaneously before breakfast. Remember, this type of insulin should be given just before a resident will be served breakfast, as it is a fast-acting insulin that will begin working within 5 to 15 minutes. Please note that only caregivers who have been trained and delegated by a registered nurse should be giving insulin via subcutaneous injections. At 12 noon, the resident will receive 8 units of insulin aspart before lunch. For this example, the resident eats the largest meal at lunch, thus requiring a slightly larger dose of insulin. Before dinner at 5 p.m., the resident will receive 6 units of insulin aspart. Dosing at 8 p.m., or bedtime, is different than meal times, as blood sugar will need to be controlled overnight. 12 units of NPH will be given, along with insulin aspart according to a sliding scale, which we will take a closer look at in the next slide. Remember, insulin NPH is an intermediate-acting insulin lasting 16 to 24 hours and is given at bedtime to help control blood sugar during this same time period. As we saw from the previous slide, at 8 p.m., the resident would be given insulin aspart according to a sliding scale. The blood sugar must be checked per the doctor's order, and based on the blood sugar level reading on the meter, is given the corresponding amount of insulin. If a blood sugar level is below 151, no insulin is given. If the blood sugar is between 151 and 200, the resident is given 2 units of insulin aspart. For a blood sugar of 201 to 250, 4 units of insulin aspart are given. 6 units of insulin aspart will be given for a blood sugar between 251 and 300, 8 units for a blood sugar between 301 and 350, and if the blood sugar is above 350, 351 or higher, the resident will receive 10 units of insulin aspart, and the doctor should be notified. Often at bedtime, the resident will also be given a small snack, such as string cheese, peanut butter on bread or toast, peanut butter on crackers, frozen yogurt, or pudding. The snack is some sort of complex carbohydrate to help sustain blood sugar levels overnight, while the NPH is helping to control the blood sugar during this same time. Please remember that this is only an example, and a resident's exact sliding scale would be found in the Medication Administration Record, or MAR, for that resident. This concludes Part 2 of the American Way University training of, "Oh no, my blood sugar is low," learning more about and understanding diabetes. Thank you for your participation. For further training, please visit our website or feel free to call our office.